Okay, y'all, I am so excited. You have been asking all the time to learn more and more and more and more and more about insurance. And hold on to your hats because we have the expert on insurance and billing. Welcome to the show, Ingrid Knight. Welcome.
Thank you. Thank you, Adrian. I
I'm
do
just
feel very welcome.
Oh, good. I am so excited you're here. We get so many questions all the time about insurance and everything. But before we like pick your brain and learn everything there is to know about insurance, I want to hear your story. I don't think I know your story of how you got to where you are today.
Sure, sure. I was just thinking about this the other day because someone asked me the same thing. And it used to be on the tip of my tongue, but now it feels like ancient history. But let me see if I can start. So I had a business degree, and then I was working in Atlanta, and I worked for an advertising agency that did advertising for a hospital. And part of my work was editing the newsletter, I guess, that the hospital sent out. And I remember seeing something about a class taught by a dietitian. And I thought, oh, wow, that sounds like a really neat, opportunity to as a job, because I was kind of looking for a different career in a way, and looked more into it and found the program at Georgia State. Went back to school, got another bachelor's degree, and did my internship at Georgia State as well, kind of already knowing that I would probably work in food service. I wasn't really leaning towards clinical. I was more into the business and sales stuff. And so first job after internship was for a food service consulting company. They only had one other dietitian. They did food service design, kitchen design, and system design. So working for big hospital companies or schools that wouldn't do, cook chill was a big thing back then, kind of new, tray systems, menu ordering, customer satisfaction, all that kind of stuff. So I was a consultant for a while and traveled a lot and loved that. Loved working on that side of the dietitian world and learning more about architecture and equipment and all kinds of stuff. And then I ended up working for a food service distributor, which was kind of my ideal in the first place. I had done part of my internship with Cisco and thought that was really neat to be in healthcare sales. So that an opportunity came up local and I didn't have to travel, or I just traveled locally. So I worked in healthcare sales there and still work with some of those clients, still work with them. That was a long time ago because I remember I had my first child when I was still there, and she's now 19. So, yeah, so I can base it on, how old my kids are. So I still work with some of their menus for some of their clients. They needed, healthcare facilities that need dietitians to sign off or do consulting for the daycares that receive federal funding. So I still do some menu consulting. And that, I guess from the beginning, I always knew I wanted to be a private practice dietitian because I would learn about people like, oh, they were kind of doing their own thing. And I thought I liked that flexibility. So I just rolled right into doing some of the menus and still doing some corporate wellness things as things came up. Fast forward probably 10 years, I guess, I didn't work for a while. And then I was in a small town in middle Georgia and they needed a dietitian to see pre-bariatric patients. So that's really how I went back to doing one-on-one consulting. And because of that, I started taking insurance. And because of that, I am where I am now. That all morphed into private practice, one-on-one consults, taking insurance, doing all the other things that I still do, like menu consulting, and now consulting for other dietitians. I do insurance enrollments for other dietitians. I consult with businesses and organizations who need to know either they want somebody to enroll their dietitians or they want training on billing or how to set up systems for the best flow of income and good outcomes with their patients. So that's a lot of what I do individually. I still have my private practice with 7 dietitians, and I do, oversee that. And then, of course, I'm a co-founder of Nutrition Practice Network, an online membership site for registered dietitians in private practice that are either starting out or looking to grow and become group practices, kind of like what I do.
Wow. I had no idea that you started out one, loving food service, because I don't think that there's a ton of dietitians that love food service and did all that. But it makes sense of why you love systems and processes, and why we reached out to you to help us set up Medicare and all that. So it makes sense why that is such a huge piece of your puzzle of what you do. Huh, with everything that you do.
I've never heard anybody say that. I like that though. It makes
Yeah.
sense to me too now because I really probably liked like I loved working in school food service or healthcare. Like you had to be standardized, you standardized your scoop and you figured out your servings, which I know we all hated doing when we were in school, but I really like that part and setting that up. And but I learned now that there's such a big people piece of that. I mean, I think it's just that you can relate that to insurance too. Like, yes, we get frustrated with the system, or yes, we get frustrated with the standards that have to be there, but there's people behind it and there's a reason behind it, that we want to take care of our patients and we want to do that in the most efficient and effective way. So I'm sure there's parallels there.
That makes sense. And so you have all these things, your private practice, your group practice, your helping other dietitians, consulting them, consulting for companies, which I think is amazing to get dietitians and billing and systems in place, and then also Nutrition Practice Network and a family. Like, how do you do it all? This is impressive.
Well, it's definitely a roll with whatever comes my way. Sometimes I will mentally say, okay, I don't want to take on any clients. And then someone will, reach out and it's a new client and another contract is ending. So it's like, oh, okay, I guess I could, So I like the flexibility. And I think I like the fact that it changes often, that it's very seasonal. I might be working on school menus at one point, or I might be working on a consulting project, and then it's going to slow down. And then January comes and the one-on-one stuff picks up. So it definitely flows, and I do have a lot of help. And I think that's probably, if I told my, past self, hire an admin sooner, get your systems in order so that somebody else can take over more of the work so that you can do the stuff that you like, or choose
Ooh.
not to. That's fine too.
I love that, of like advice that we would tell our past self. So hire an admin sooner, get systems in place. And, as far as like, because you like chose to do insurance right off the bat, is what it sounds like. Where should somebody go with that process? Should they just like all like jump in feet first into insurance, like, or would you suggest other things?
Sure, that's a good question. I think the first thing is just whenever you're marketing or thinking about a business, you think about what is your demographic? What is your target market? Is your target market people who, generally want to use their insurance? Are you like us? And, I had a dietitian tell me when she started her private practice, she would see anybody who walked in the door. And that's kind of how I felt like, for the most part, as long as it was in my scope and I felt comfortable doing it, I saw everybody except eating disorders and renal. And then I hired those people. And so that lent itself to the demographic of people wanting to be able to use insurance, and the physicians who wanted to refer to me, they took insurance. So it made sense for that. And then I would say find out what insurances are popular in your area. So you've determined you want to take insurance. Now, which ones are you going to enroll with? Some people would say, oh, just enroll with one or two to kind of get your feet wet. I just say jump in, and that's kind of what I do with my one-on-one mentoring and credentialing. I will enroll people with however many insurances they want to enroll with. And we do it all at once, rip off that Band-Aid and just jump right in. And because a lot of the application work is going to be similar for each insurance, a lot of the coverage is similar for each insurance, and the way you bill is a little bit different with each insurance, but the billing, itself is the same. So to me, it makes sense just to jump in and take them all and enroll with all of them. But for some, it makes more sense if they have more time to just enroll with one or two. Because I know when I started, I felt like I had more time than money. So I did all the enrollments myself. And, that was painful, but I learned a lot from it, and that's okay. But it just takes longer. I feel like if you're constantly having to do another application and follow up on things. I liked having it done, one and done.
Yeah.
So finding out which insurances are popular, that might be based on your in big employers in the area. If you are marketing to your local area, now this is obviously a little bit different if you're marketing nationally, but knowing that you will enroll with the insurances that are allowed for you based on your geography. Insurance is still behind on the telehealth curve. They still see us as in-person, geographically located providers. So if I say I live in Atlanta, Georgia, I want to accept insurance, they're going to say, okay, what county do you, not live, but where is your business living, whether that's a virtual address or a real address. And you're going to enroll with Blue Cross of Georgia. You're going to enroll with Aetna in Georgia. You're going to enroll with all these insurances in Georgia. So you're going to enroll with those. But which ones are you going to enroll with based on your referral source, which, again, because the insurances are behind and they still see us as geographically located, whether you want it or not, you're going to get local referrals because people are going to find you based on your geographic location. So that a patient can say, well, I live XYZ. It's going to say, find a provider within 100 miles, even if you're just doing telehealth and you're not in an office. So let's say, I'm in a university town, that university health plan is Blue Cross. I'm going to be taking those. I might know that from, because of my knowledge of the employers, but also in my marketing and talking to other physicians or referral sources, they would know. You can ask an office manager in any doctor's office and say, what insurances do you see? And they'll say 80% Medicare and 20% that, like, they know it down to the percentage.
What a great advice. I think a lot of times what I hear from our listeners is it's just so overwhelming of, well, should I take insurance? Should I not? And I love that it's understand your target market. I think that that's so simple, but yet we forget about that. And I love too that you talked about referral sources. And even in the world of telehealth, it's still starting in that community and then growing. I think it's really important to know who is going to refer to you, how are people going to find you, because telehealth is so big and everyone's like, oh, I want to see people nationwide or in multiple states. With all of that, like, in your opinion, what should we start just like marketing all across the states that you're licensed in, or should you just stick local? What do you recommend?
I think it depends on your goal. If you're talking, and honestly, it does depend on how a person pays, which that's really the definition of whether it's insurance or self-pay. Are they paying through their insurance or are they paying self-pay? If they're paying through their insurance and that's your marketing target, I would say it's natural to market locally. I mean, why not? Some people still like to know that I know that dietitian down the road, or I know that person is a part of our community. There's nothing wrong with that. And then, expanding from there. And because you're in that state, again, like you said, you could go ahead and say, oh, well, I'm licensed in the state. How can I market to the rest of the state to expand my opportunities via telehealth? Especially if you're just, and I guess what you were saying too, is that if you're thinking you're just telehealth, still, why not start local and spread out from there? At the same time, I know that what I consider more self-pay marketing would be more of a national level. But you can be aware, you can use that and leverage your insurance in-network status by saying, hey, I can see you in XYZ state because I'm licensed there and I provide a service that is unique to your needs, but I also accept your insurance. So I think you could go either way. It can definitely be a hybrid model of self-pay and insurance-based and local and global marketing.
Wow. So many things. And I think this is just like a great time for dietitians. And I want to jump into more insurance because I know a lot, and we could have just like pick your brain for days on end. And I'm so glad that you guys have Nutrition Practice Network for dietitians to learn even more and get more in-depth help there. But Okay, so we've got credentialed, we're ready to go. Like what I hear a lot of our listeners say is they're scared of the denial. Like, oh my gosh,
Mm.
where, like how often does that happen? And what do you do? And I'm not going to make any money. And da, 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 da. Like, how do you talk somebody off that ledge of like, it's worth it, I promise.
Right. That's something I hear as well. Um, Part of it is just like you said, learning and teaching yourself, or hiring a biller for that matter, who really understands it. We do have some educational materials and Nutrition Practice Network in the document library, which is available to all of our members, and they can just download that and have their paperwork. And that sort of leads into uh, getting your system set up correctly. And there isn't really one right way. It's just to say, let's have things set up and systems set up and policies set up so that we can get paid. And if there is a denial, we know how to handle it. Our patients are comfortable with it. So something we also have in the document library is your intake forms and your practice policies. And we also have a playbook, which is sort of a standard operating procedures. All of these can be downloaded and edited as needed. But just to say, okay, what's the process for billing? What's the process for verifying insurance? I like to tell people that if they do it right from the beginning, in the sense of, I'm in network with insurance, I've verified that patient's benefits, I know that they have medical nutrition therapy covered, I know what diagnosis to bill, and I build it the correct way, you're going to get paid. I would say 95% of our claims get paid and there's no denial. Now, a rejection is something different than maybe of like just an error on the claim and you can fix that easily. But what if it did come to a denial and you've done all that back end work? You have this beautiful form that you or the patient did to verify the benefits that said, oh, this is a covered service. We know it's a covered service. Someone from the insurance needs to reprocess it. Again, having a playbook, standard operation procedures, how are you going to handle that? Is the patient going to call? Is somebody from your office going to call? Or is there a way you can do it online to have it resubmitted? And then the insurance pays. But just having those systems set up on the back end before the patient even comes in the door, I think is key to being successful when you're taking insurance.
My jaw is like dropped, y'all, because having that playbook when starting out is gold. So if you guys remember nothing from today's podcast, it is to go and be a part of Nutrition Practice Network and get that playbook, because I'm sure I have talked about that on our podcast of like, oh, you need to have a playbook, you need to have your systems and process, and it takes freaking forever to make. And to get that all like, I'm just like, where were y'all so much sooner? This is amazing, because it takes the stress, I think, out of the practice owner to know what to do in a denial. That's huge. Wow. Thank you for creating that.
Oh, you're welcome. Again, I wish I had that in my past self.
Yeah. Okay. So in your opinion, what are your thoughts on Medicare? Because in my world of eating disorders, it always was like, darn, it's not covered. So we're Medicare providers because we are seeing more and more different patient populations. But for somebody that is a solo provider or has a small group practice, what are your thoughts? Should somebody jump into Medicare? And then I want to hear about Medicaid.
Okay, good. Both public insurances, that's how we would define them, as opposed to private insurances, which would be your commercial, like what you would get it from an employer. Medicare, I love, and it probably goes back. It probably goes back to that. You said I like the system. I like everything being, just in a certain way, because it is black and white. It tells you exactly what to do. There's no gray area. They only cover diabetes and kidney disease for what we're referring to medical nutrition therapy in a private practice or outpatient setting. The enrollment is confusing, but it's also very like they will send you a letter right away and say, an email and say, you did something wrong, please fix it. That's why I love Medicare, because you are not going to get the denials like you would for some other plans, or have so many different coverages. Like you say, Blue Cross, that could mean so many different things. So those are the reasons why I do like Medicare. Yes, it is limited to kidney and diabetes, But as I stated before, if you're like me, like I'm going to see whoever walks in the door and I can handle a diabetic patient, absolutely. And I've got a huge geriatric population or a huge Medicare population in my area. It's definitely going to benefit me to take that. Um, Even with renal, I mean, come on, that's a super specialized, in my mind, thing. And if you take can do anything with kidney disease, for sure, I would definitely recommend taking Medicare. And the reimbursement is good. You can look up the rates for your area in online. It's public information. Misconception is that it only covers 3 hours a year. It does, but then if you get another referral due to a quote unquote change in status, there's some details on that. But if you can get another referral in the same year, then the patient can be seen the rest of the year unlimited. So there really isn't that much of a limitation. And as you know, I mean, I would imagine some of your clients are coming in and they have disordered eating or eating disorders, but they also have diabetes. And so you're going to see them for both, you know. So there is some coverage, you know, crossover there. The other thing is, you know, from a advocate standpoint, the more that we bill, the more that we enroll as dietitians, the better presence we are, the higher presence we show to these insurers, whether it's public or private. If we have an NPI, if we enroll with insurance, if we bill insurance, they're seeing that data. And then also, oftentimes, they're seeing the data of the better outcomes. And that's really what they're looking for, that we are a lower cost provider than a physician or most of the times medication. And we have great outcomes. So we can show to providers, to Medicare especially, because they are the ones that really track this kind of stuff, that we're doing a great job. And hopefully they'll expand some of the coverage. We're, you know, fingers crossed that they're going to continue with telehealth services and then hopefully continue and start covering some other things.
Oh, wouldn't that be amazing? Oh, I know. We'll keep, yeah, everybody keep becoming providers and providers for Medicare. Okay, let's talk Medicaid for kiddos. What are your thoughts? Because I haven't even touched that with a 10-foot pole because it feels confusing to me. So, what are your thoughts?
Well, it is in the sense that Medicaid is a state program. So we talked about Medicare, that's federal. So it's going to be the same for everyone across the country. Medicaid is state-based. So we can only speak to Medicaid when we're talking about a specific state. So it sounds like Texas is probably like Georgia is. Our Medicaid plans for nutrition services only cover children up to age 21. And so there is a limit. Now, I don't know if that's true of Texas. I can only speak to Georgia. So there's a limit. It's for kids, you know, that qualify, that do have Medicaid. So what I would say to those who are interested or think they might have that demographic, I don't even know if it's just children. I know it's not just children in all states because most states have Medicaid for people who qualify who are also adults. But the question is two questions. Does your Medicaid state cover medical nutrition therapy? And you should be able to find that from your state academy payment services representative, or, you know, reach out to a dietitian in WIC or maybe someone at the public health department, because usually they're working with Medicaid patients. They may know more. So find out if medical nutrition therapy is covered and find out if dietitians are allowed to enroll as providers, because that's not the case in every state. And so that would be, you know, the two things to find out. If you can get in and it's a covered service and it meets your population, go for it. The nice thing again is that it's public. So the information required to find out those details should be online, if not easily accessible.
Oh, good. So again, it goes back to your target market, back to, is this a good fit for your business model, as opposed to yes to everything.
Right. Right. Which is what, you heard me say that earlier. I'm usually like, yes to everything. And we used to take Medicaid. We don't now, but, definitely looking at, it's going to be unique for sure. Because it's based on states, but I always recommend connecting with someone that is in your state, maybe that's already in the same practice. We do a lot of that with Nutrition Practice Network, where we're able to, and honestly, I just feel like we're in a just dietitian's kind of a small world. I don't know. Like if someone said, "Hey, I need a dietitian in Maryland," I'd say, "Oh, I know somebody," and not, it's just randomly. It's not because I know them, like we grew up together or something. It's just you meet dietitians from all over. So like with Nutrition Practice Network, we're able to connect people from all different states and different parts of the country, which is nice. And say, hey, well, you should, talk with this person or meet with one of our experts on different areas.
Yeah. Oh, I love that because it's so lonely. And when you're starting out or when you're starting to grow your business, you want to talk to other people that are in that same life situation. Like, am I doing it all right? And it's even nice if they're in your same state to like, hey, how would you do it in this situation? And then eventually maybe meet up in person so you just don't feel so alone.
For
I
sure.
love that. So, okay, we're in our business, we're accepting insurance, we're moving and grooving. We have our playbook, which is amazing. What is kind of, as you're thinking about and what you've seen with your People in Nutrition Practice Network, like, is it mainly just kind of maintaining status quo? Like, how do you kind of keep that momentum and that, I guess, love for the business keep going after these days and days and days?
Oh, for sure. I think that just like I was saying, that the reason that I love the work that I do is because it is constantly fluctuating, and I can make that work for me, or it could be just remaining the same. I don't know. I could just be like, oh, let me just paddle along and not open a new office or bring on another dietitian. And then next year I might be like, oh, let's hire 6 people and open 3 offices. I think it's just a matter of meeting people where they are. Whenever I talk to new clients for either my individual mentoring or for Nutrition Practice Network, we kind of say, okay, well, where are you? Where are you in your practice? Are you completely new and working full time and thinking about doing it? Or have you been doing some side hustle things for a while? Or you have been working really hard and are so busy you need to hire? I think the key is what you said, is to not remain lonely and reach out and be able to connect with other people. We have mastermind groups in Nutrition Practice Network, and that's huge. I mean, as you know, that's how Adrien and I met, was through a mastermind group. So I never thought that would, I thought, oh, well, it might be nice, social or kind of bouncing ideas off of each other. I can't explain how much I've grown just because we were in the mastermind. Adrien would bring something to us. Oh, you need to read this book, or I've done this thing with my practice and it's worked really well, or I hired this person and we use this interview tool, or have somebody leaving. I need an exit interview tool. I mean, just things that it's what I learned with my first degree, which was CQI, continuous quality improvement, which is not something that you always hear like in nutrition systems, but in the business world, that's pretty common, that you're always looking to improve in some way, and sometimes it's just really small, like having a playbook or getting a dedicated voicemail, or I don't even know, just one little thing, or getting a water cooler in your office, who knows, but like things like that, or that you all have shared with in the mastermind, that I never would have thought, oh, I should do that, so it keeps you excited. I think that's part of it. It's just being, finding out like what's next. Like it's not always, doesn't have to be stable. And honestly, it doesn't have to be the same for everyone. Like I said, there's just no right way to have a private practice. You can take insurance, you can not take insurance. You can do one-on-one, you can do groups, you can sell things passively and not talk to people, that's okay. It's all okay. But it's exciting to hear from other people who are making it work in their own way.
I love that. And I love that you guys are having masterminds. And like you said, people have so many other ideas and lived experiences, and we can all learn and grow. And when you have people come together and are vulnerable and share as business owners, it really helps you to fall back in love with your business, to see that, okay, I'm not the only one struggling this way, or, oh, we can share wins together. It's so powerful. And it makes you like not feel alone. Like you said, oh, I love that. So at the end of every podcast, I always like to ask our guest any words of advice for our listeners that are just starting out or ready to take that next step. Where should we take action this week?
Oh, goodness. Oh, I knew I should have asked you what it was going to be one little thing that you were going to pop in that I wasn't ready to answer. What should we take action on this week? Part of it is probably because we're getting towards the end of the year, and that November, December time always makes me think like, I don't have time to commit to a big project or a big conference or anything like that. But I want to think about what is it that my referral sources are, how do I nurture my referral sources? That end of the year, it starts, I don't know, maybe just thinking about comfort and coziness. And I think these are the people who really, trusted their patients with us. So are there ways that I can give back to them, give back to the community? Even just reaching out, sending a card, a handwritten note that says, thank you for, trusting your patients with us. Do you know that we now offer RMR testing or something, something to get them excited about coming up into the new year, because I know it's still a busy time for them, but they're going to be like us in January. You're talking about Medicare, everybody gets their annual wellness visit. So January is going to be super busy. So what can I do to help nurture that busy time that's going to be January, and kind of give back to the people who have supported me and my business and my dietitians this year?
Oh, I love that. I think it's something that is so vital to nurture those resources, those referral sources in your community. And it's something that I've heard a lot of dietitians will put off and put off. And I love that that is your advice, that somebody can do this week, because it truly is what I've seen that sets the people apart from those that have successful businesses, and that this is just a hobby. Oh, Ingrid, this has been absolutely wonderful. I took a ton of notes. I know our listeners did. How can we continue to learn from you? Where can we find you?
Okay. Well, you can find me at my website is ingridknightrd.com. And that will also have links to Nutrition Practice Network, which is nutritionpracticenetwork.com. You can go to, we also call it NPN for short. You can go to Nutrition Practice Network. We have a blog. We always have a downloadable freebie. So I don't want to say what that is right now because it is evolving, and depending on when you're listening to the podcast. We are looking forward to having some other free webinars, and we do monthly Q&As for our mid and higher level members. And sometimes we're going to be opening up that Q&A to the public. So if you get on our mailing list, you'll get emails for any of those free opportunities. And I tell you, the Q&As are awesome because it is usually 2, but I have to say, sneak peek, I think we're doing 3 in December, and I think we're going to open it up to the public. And you'll get an invitation and you can join our Zoom there. So you get all 3 of our experts at once for an hour. You can submit your questions ahead of time. You can ask questions live. So I'm pretty sure we're going to be doing that for December as a freebie, but like I said, we've got the blog, has some other lots of information that you can get without being a member, but I encourage you to go to Nutrition Practice Network and check that out. And then if you're looking for more direct credentialing information, you can find me on my website. I think that's about it.
Oh, I love it. Well, we will have all of those links in our show notes, and I think everybody that is listening needs to go and sign up for those Q&As. That sounds amazing to get to chat with you guys. Ingrid, this has been so wonderful. Thank you so much for hanging out.
You're welcome. Thanks for having me, Adrien.